Thank you very much. And as indicated, we thought we'd take the opportunity today to talk about a number of different issues and answer some questions that have arisen both from media and from the public over the last few weeks. So that's an opportunity for us to show some of the information that we've collected that is not always readily apparent in the way we present it on the BC CDC dashboard. So to start off with, I've been asked and we've been concerned about the issue of young people and more young people being seen in hospitals and in ICU, and if that is a true increase in risk and severity, or whether that reflects what's going on in the community. So we've been looking at this in some detail, and this will be familiar to most people. As we know, in the last month and a half in particular, we've seen an increase in cases in people aged 19 to 39 in particular, and up to age 39 to 40 as well. So that is concerning. And that does reflect the fact that the good news is that we are seeing decreases in older age groups, particularly the over 80 age group, as we have protected more and more of our seniors and elders in long-term care. So because the numbers are increasing, the concern is, are we seeing more people hospitalized and more people proportionately in having more severe disease? And so this is a look at hospitalization by age and how we've progressed through the pandemic. And what you can see is that we have very low and stable rates of hospitalization for the younger age groups. So that's important to note. As we've seen over the last couple of months in particular, we have seen increases in COVID cases that are variants of concern. And in particular in BC, we've seen an increase in the B117 variant of concern. And that one we know is increased transmissibility, so it spreads more easily. And we've now seen data particularly from the UK, but some other countries as well, that shows that it can have increased severity of illness in younger people across the age spectrum, but that reflects also in younger people. So we are concerned about that. We've ramped up our capacity for screening, and as you know now, almost all of our cases every day are screened for mutations of interest that might be one of these variants of concern. There is still a day or so delay, which is one of the reasons we report it a little bit separately. So these international data suggests that the B117 could be more transmissible and could be associated with higher risk of more severe outcomes. What we have seen, though, here, that we've had just under 1,600 hospitalizations among people who are under age 60. Of those, 19% overall were people who required admission to ICU. When we look at the very small number of people who have been hospitalized with a variant of concern, and so far we have not seen an increased risk of hospitalization in that group, but the numbers are very small. We have, however, seen a slightly higher risk if you are hospitalized with a variant of concern, that about 30% of people required admission to ICU or critical care. So that's something that's a signal that we're watching. So far the numbers are very small, so it's not something that we necessarily will is a worry, but it is something that we'll be watching and investigating further. The other thing that this does reflect, when younger people are in hospital, they thankfully have a higher proportion of people who survive, but it does mean that their stay in hospital is often longer, and we're seeing that reflected in the rates of hospitalization that we're seeing right now in the province. So that was one of the issues that has come up that I wanted to put a little bit of attention to today. The other couple of questions that we see very frequently, and I just want to say that I am very appreciative. People send me many, many questions, and we try to put answers sometimes through these media briefings, sometimes through the information, the Q's and A's that we put up on the BC CDC website in particular. One of the things that people have asked me many times is about, especially now, why are we seemingly easing restrictions when we are seeing a definite upward trend in cases? And that, especially in this past week, we've seen again a turn upwards. And really, it's not about easing restrictions as much as recognizing that at this phase in the pandemic, we need to focus on those things that we can do safely. So we know, and we've learned through the past year, that things that are done outside are much safer than inside. And that is what we need to focus on for the next little while to get us through this next few months as more and more people are protected. So the other thing that we have learned, of course, is that the vaccines that we have are very effective in protecting people, and particularly protecting seniors and elders who are most at risk. So that gives us some leeway to be able to have some activities, particularly outside activities, that are safer. And we've reflected that in the outside gatherings that we're allowing now, as well as in the outside services for faith leaders. I do want to remind people, though, that it is those inside activities that continue to be increasing risk. And I get asked all the time, where are people transmitting and why are the numbers going up? Part of that is because we are still actively following people and making sure that we're finding cases as much as we can, and people are getting tested, and the testing rate now is very efficient. The turnaround time is very low. But also it reflects the fact that we have ongoing transmission indoor settings. And there's a combination. We saw that there's an increase in younger people. So the combination that we're seeing is social events, small gatherings. We know that people need to get together, but we're seeing that people are taking that risk. And unfortunately, with the amount of virus that's spreading in the communities around the province, but particularly in the Lower Mainland, even a small group of people coming together means that you can transmit. So those are the things we need to pay attention to coming through this next few months. The other area where about a third to 40% of our cases are rising are in work sites. And these are work sites across the board. Some of them are small settings, like a small restaurant or a gym. We've seen many different settings where where transmission can happen to one or two people, but then that person will go to their work site. We've also seen large transmission events and outbreaks in many of the essential workplaces that we have around the province. And so we have taken some measures, as you know. We're addressing some of the outbreaks with making sure we have the tool of immunization to help us with addressing particularly the larger outbreaks in some of the more essential workplaces, and those workplaces where the COVID safety plans are really difficult to adhere to over time. The other measure that we're taking is we've been working with our workplace task group to put in place protocols for investigation of clusters when there's been transmission in a workplace, and we're going to be stepping up the monitoring and the enforcement of those, including making sure where there is transmission in a workplace, that workplace is shut down for a period of time during which people are isolating, so they're not continuing to come into that workplace as much as possible. So that's something we'll be paying more attention to with our environmental health officers, working with WorkSafe PC in the coming weeks. We've also had a lot of questions about variants of concern, and I've mentioned some of them as well. But the bottom line with the variants is they are replacing and taking over the other virus strains that we have seen over the last little while. But we do know that the measures that we take to prevent transmission are the same ones that work for these variants. And we've seen that internationally. It is, of course, a concern where some of the variants that we've seen have issues around increased severity of illness or lead to concerns about whether vaccines are as effective. That is why we need to pay more attention. There's little room for margin for error right now, and that's why we continue to have the focus on restriction of indoor activities. Finally, I know there's been a lot of questions in the last week about things like clinically extremely vulnerable people and the letters that people will be getting in the mail. That list is a very specific list based on risk that is over and above the age base that people are in. So these letters, we focused on people between the ages of 16 and 65 and 69, and that is because everybody else is in the age-based program already, and within the next week will all be eligible for vaccine. So it is people who are moving up the queue because of a health condition that they have. So it's supplemental to the age-based program that we have, and it's based on risk. And there was a very rigorous process that we went through with specialists in cancer care, in genetics, in developmental issues, led by the Provincial Health Services Authority, that identified the categories that we are talking about and the people that received letters or will receive letters in the next few weeks. So those categories are very well defined, and they're that way on purpose. These are specific conditions, and I know many people have been calling my office, many people have been calling others because they are concerned that they are on this list or are not on this list. And I just want to say we all need to be patient. There will be vaccine for everybody. And as we move down through the age groups, people will become eligible. And the good news is that is rapidly speeding up in the last few weeks. But there is a process for this clinically extremely vulnerable people that is based on evidence and based on risk. And we'll be adhering to that process. The other question that I've received a lot of course, in the last few days has been around who is eligible for the parallel process of Astrazeneca and the Covishield vaccines that we have, the fridge-stable vaccines. And again, we had a limited amount that we received about 2 weeks ago, and we are focusing on where we can put out outbreaks and address some of the high-risk areas in our communities. And we know, particularly in the Lower Mainland, we've been looking at that, looking at congregate living settings for farm workers. But these are all directed by public health, where we recognize the risk, where we have seen risk in specific communities, industries, and businesses. And you will be contacted directly by public health if you're part of that program right now. As for the part 2 of that, if and when we receive more of the AstraZeneca vaccine or other vaccines, and right now we don't have a timeline on that. We're still getting information from the National Operations Center on when we might receive more vaccine, but it will be in the coming weeks. And we have defined those groups for some people, and we are working on the working out of the other higher groups that were presented last week. I know there are many people who feel they should be in that group of people, but let me just say there's a limited amount of vaccine, and we have based this on a number of different principles, including risk, including societal disruption, and the ethical framework that we have. And it does not in any way reflect the value or the essential work that so many people have been doing across British Columbia since this pandemic started. It reflects merely the amount of vaccine that we have and where we can best target its use to try and minimize societal disruption and to protect and to prevent transmission in our communities. And as we have more vaccine, we'll be expanding that program. But I will remind everybody that we also are moving ahead very quickly with our age-based program, and very soon, within the next few months, those will converge and everybody will have vaccine available. One of the other things that we've been working on over the last number of months has been working with faith leaders across the province, and we've come up with a variance to the gathering and events order that applies to outdoor religious services and faith services. And we've also developed a variance in close collaboration with the faith leaders across the province through a dialogue process led by SFU's Morris J. Wask Center for Dialogue and Dr. Robert Dome. And we now will have a variance as well for indoor religious services for a very specific frame or set time coming up in the next few weeks, where we know there are a number of important religious holidays. And I'm very, very grateful for the expertise and input that I've got from leaders from a very diverse spectrum of spiritual and faith communities. This represents a first step in the gradual reopening of indoor faith and spiritual group gatherings in British Columbia. It builds on our recent outdoor variance, which permits outdoor religious services for up to people with specific conditions. And we are hopeful that this one-time indoor variance can be extended as soon or after the end of the trial period that we have in May 13th. But of course, it's based on the pandemic and the epidemiologic situation that we're seeing here in BC. So time will tell. The time frame that we have for this variance is March 28th to May 13th for indoor, and that was selected with careful consideration of the very important upcoming holidays across different distinct faith communities in the province. It comes against the backdrop, as we've just talked about, of increasing case counts. And if conditions require us to revisit this, we will do so in consultation again. And I am very appreciative that the faith leaders have expressed that we all have that common goal of keeping people safe through this very, very challenging year. We take no pleasure, of course, in limiting any of the religious community's practices, and we want this to be a success. We want to make sure that we are protecting those most vulnerable amongst us. So we ask as well that people who take place in these both outdoor and indoor gatherings cooperate with their leaders, understand that this is a way of us trying to meet our needs for connection and community, to comply with the public health need that we have to try as much as possible prevent transmission as well. But I have respect and faith and trust in our faith communities that we will continue to work together to make sure that we can do this safely in the coming months. Okay. And finally, I'm going to talk a little bit about another very important change that we're making, and this is in our visitor restrictions in long-term care and seniors assisted living. As you know, there have been no group more adversely affected in our province than our seniors and elders and people who work in long-term care and assisted living. And I am very, very pleased that we are at a place where we can make some changes that will affect people's quality of life. As you know, since last March, we've had restrictions on visitations. We changed those and modified them in June of last year and have updated the guidance as we've gone along. But really, the most prominent priority that we have is to protect those most vulnerable to severe illness. And we know how this virus can be so pernicious and spread so quickly in these facilities. With this added layer of protection, however, that we've got from immunizing the most vulnerable amongst us, it means that we can support safe social connections again. So as of April 1st, to give facilities some time, we've consulted with many of them across the province, and to make sure that we can get these in time for some of the important holidays as well. As of April 1st, all residents will have regular, frequent, and routine opportunities for social visitation in long-term care and assisted living. We know that visits must allow for a minimum of an hour. For some residents, that may be too long. They may not be up to having visitors for that long, but that's a minimum that we need to be able to have for each visitor. Requirements for the single designated social visitor are removed, and now you can have additional friends and family. However, we will be limiting the number of people at any one time, so to 2 visitors plus a child, to allow for visits to grandparents and great-grandparents as well. The location of visits are now changed so that your family and loved ones and friends can visit in a residence room primarily, and will have provisions for residents who are in multi-bed rooms. And of course, the all-important physical touch. So we are now at a place where we know most of our residents are protected, and we can allow for that important connection between family and friends and visitors, but bearing in mind that we still need to have infection prevention and control measures in place, and that will mean wearing masks for the time being, because we know that there is still a possibility of transmission, and that not all visitors will be immunized at this point. There will be other restrictions, like only visiting your one friend or loved one and not visiting multiple people. And I think that's a really important one. And making sure that visitors aren't participating in group activities where their risk can spread to others. But we also know that removing some of the social and emotional connections within a facility is very important. So we'll be removing the physical distance requirements between residents so that we can have things like communal dining, small group social or recreational activities for residents. But it will be within a limited place, so not the entire facility if it's a large facility, making sure that we're not taking too many risks. As well, residents will be supported to go on outings with no requirements for isolation when they come back, including outings with family and friends, and removing the requirement for a 14-day isolation when somebody is admitted to the facility, and making sure that we're stepping up the immunizations of people who are awaiting placement in long-term care. As we know, outbreaks have decreased in long-term care and assisted living, and as a matter of fact, we have only 3 now. But the rate of transmission in our community remains very high, and in some cases is increasing. So we need to make sure we have safety precautions in place. That means minimizing interaction between residents and visitors, making sure that we have adherence to infection prevention and control, screening out of people who are ill, monitoring, signing in, so that people aren't putting people at unnecessary risk. The reality is that it is likely we are going to have more outbreaks in care homes now that we're allowing more people to come into those care homes. But we are at a point where the benefits of having those social connections and interactions outweigh the risks, and we know that we can manage those risks with the vast majority of residents and staff now being protected with immunization. So as I said, social visitation will still have some restrictions in place around advance booking and screening, etc. So these changes are effective starting in April 1st, and we'll be looking at them and revising them as needed over the next few months. And we're committing to looking at how we can expand them by at least June 30th, depending on how things go with our pandemic. So we will be posting the updated visitor and infection prevention and control guidance very soon, and continuing to monitor so that we can support staff and residents and families and communities to make sure that we're doing this in a safe way, and we will review and evaluate the restrictions as we move forward. I think this is an incredibly positive step that many families and care homes have been waiting for some time. We are in a very challenging place, as we know, with the pandemic across the province. In some communities, rates are increasing quite dramatically. So we will need to take this slowly, but it is an important step forward to being close again and supporting our seniors and elders who have suffered so much in this pandemic. So I'm going to leave it at that. Lots of bits and pieces today, and turn it over to Minister Dix.
Thank you very much, Dr. Henry. And I think it's also, with respect to long-term care, a really good day. You'll see soon posted on the BC CDC and Ministry of Health websites this document, which is an overview document of visitors in long-term care and seniors assisted living for people who I know will be very interested in all of the details of the announcement, to find it there. It was St. Patrick's Day last year when public health emergency was declared in BC, and on that day as well, Dr. Henry and her team informed long-term care homes in BC that visits would be limited to essential visitors. And I think it's fair to say, and I know this because of the many people, many family members of people in long-term care, including my own family, that many of their friends, many residents of long-term care who've contacted us and spoken to and corresponded with, that it has been not just a long, cold, lonely winter, but it was a long, cold, it was a long fall and a lonely fall and a lonely summer. These measures, I think everyone understands, were necessary, and they were part of a series of measures involving PPE and adding staff and single site. Today I can report that in our plan over the next 3 years to add 7,000 workers in long-term care, 2,500 have already been added. This extraordinary measures by health authorities on more than 100 occasions to send in teams to facilities with public beds and private and not-for-profit and for-profit facilities to support staff there, and the long list of measures in support of long-term care and efforts in support of long-term care that, of course, include, most importantly, the extraordinary commitment of staff and of families and of the residents themselves in trying to make the best of what has been an extraordinary and difficult situation. So I am, like I think everyone in BC who knows someone in long-term care, moved at the idea that people will be able to visit again who weren't able to visit, touch each other again who weren't able to touch each other. It will make an extraordinary difference. And our commitment, I think, that goes beyond the government to society as well, is to continue to make not just life, to improve the safety in long-term care and to ensure that people live longer in long-term care, which is happening, but that we live better. That should be our commitment to one another, because even if our family members are not currently in long-term care, or we are not in long-term care, that day almost certainly will come for every family in BC. I want to also acknowledge the efforts to vaccinate in long-term care. As you'll know, more than 30,000 residents, close to 40,000 staff people, more than 8,000 essential visitors in assisted living, similar numbers have been immunized in the time. We had 42 long-term care outbreaks, 49 long-term care assisted living and independent living outbreaks on January 15th. And we now have 3, 2 in long-term care and 1 in assisted living. That tells us what immunization can do for all of us. But that moment for all of us is, of course, not here yet. I wanted to make a couple of points about immunization because, like Dr. Henry, we get questions. I even got questions in the legislature today 610,671 doses have been delivered into people's arms in BC. 520,459 of those were first doses, 87,212 were second doses, 28,037 doses today, a new record, and we will be setting records day unto day unto day. I also want to note that we've received this week about 161,000 doses of Pfizer vaccine. So some of that was Monday, some of that was Tuesday, some of that was Wednesday, and then distributed to health authorities. Much of that, a significant portion, not all of it, but a portion of it has already been used. I would note that of Pfizer vaccine, 462,573 doses, and at the rate we're going through, it will have the same situation this Sunday as last Sunday, which will have used up virtually all of the Pfizer vaccine that we'll have received, and be looking forward to our new shipment. With respect to Moderna, we are expecting more doses tomorrow, and then through the weekend and into next week, that delivery has been less consistent. But at present, we have only about 10,000 doses of Moderna. This was as of yesterday, on hand. And people have asked about Astrazeneca and doses that may expire. Doses that may expire of AstraZeneca on April 4th. Those doses will all be used. Already, more than 22,000 doses have been used, and we're well on our way, as all of you know. In short, the immunization campaign that's been led by our whole team, the team in public health, the team led by Dr. Penny Ballum, the team led by Deputy Minister Steve Brown, has been nothing short of exceptional. When vaccine comes, it's delivered as it should be, and it's being delivered to those who are most vulnerable, and we see the impact of that in long-term care, and I am proud of everybody involved. I want to say, finally, just a couple of more administrative notes. As you know, at noon today, people 75 and above, born in 1946 or earlier, were invited to call Regional Health Authority call centers. We've been receiving large numbers of calls, and the turnaround, I think, in general has been very good. On Friday, March 26th, that will be people 74 and above, born 1947 or earlier. As Dr. Henry noted, those who are clinically extremely vulnerable will receive an invitation letter to book. We'll start booking on Monday, March the 29th at noon. And with respect to, and I will spare people a little bit, an extensive discussion of surgeries, just to note that the week of March 8th to 14th, the number of surgeries completed in BC was 7,557, which is 552 more than the same week last year. We're not going to be making that comparison anymore. As you know, we're a year past when we interrupted surgeries, so that number in future weeks will obviously be a large difference, but that's related to the decision to put a halt to non-urgent scheduled surgeries. So in closing, 4.3 million people in BC eligible to be vaccinated. 523,459 have received their first dose. That's 12.1%, 7% of British Columbians vaccinated with their first dose. And with that in context, we had hoped that that number would be 10% by the end of March, and so we are ahead of schedule of what we had expected, but obviously 12.17% is not close to community immunity. We've shown, I think, what a restorative difference some days could make. Today, the changes in visitation. Last week, the surgical renewal commitment progress, which showed that our wait list for urgent surgeries had dropped by 12% compared to last February, an extraordinary achievement by healthcare workers. We've shown, and we're going to show, I think, working together, that it's possible to have religious gatherings outside. Dr. Henry talked to that on Tuesday. And that we're going to show, I think, during these important religious holidays coming up, that some coming together is possible. But let's, be clear. The level of transmission in BC is way, way too high. And we have to collectively do something about that. Not for a long time longer. We're a year since the beginning of just over a year more than the beginning of the pandemic. But right now, we all need to take steps. Sometimes people say, talk about measures. We have powerful measures in place with respect in every business. We have measures in place, and we have powerful measures in place with respect to social gatherings. Essentially, you can gather indoors only with people in your household. And that has to continue for the moment. The numbers tell us, the numbers yesterday tell us, the numbers today will tell us, the numbers tomorrow will tell us that that is essential for everybody. That at the end of this pandemic, this awful, awful virus, which can affect all of us, should not affect so many of us at the end of this pandemic, putting so many of us at risk. I ask everybody, given the good news, which is the result of the good work of people in BC, resuming visitation, protections for long-term care, the opportunity to do some more things together, the opportunity to go outside more, that the orders that are in place be followed right now. It is going to be April next week, and we are moving forward. We're moving forward to 1 in 8 people now immunized in BC who can be immunized in our province. But we've got a ways to go, and we really need to dig it in. We can see the light, but the fact of that light means in the present we need to hold on a little while longer, and I encourage everybody to do that this weekend and in the week leading into the Easter long weekend.